Question 51. The doctor has told a resident that his cancer is growing and there are no more treatment options. When the resident tells the nurse aide that there is a mistake, the nurse aide should A. Suggest the resident get another doctor and more tests. B. Remind the resident the doctor would not lie. C. Understand that denial is the normal reaction. D. Ask gently if the resident is afraid of dying soon. Answer C. Explanation. Even people who are very ill can experience shock and denial when they realize that they are going to die. Denial is the first and natural response to loss. It serves as a temporary defense mechanism that prevents being overwhelmed by what must happen. During the denial phase, people may ignore facts because they are too painful to face. Do not confront the resident or suggest they continue to seek medical advice. Allow them to think about the news and to reach their own understanding of the situation. Question 52. Mr. Tyler states that he wants to commit suicide. What should the CNA do? A. Ignore his statement and ask if he wants a snack. B. Stay and talk to him and with call for help. C. Call his family and ask them to deal with him. D. Tell him things are not as bad as they seem. Answer B. Explanation. Do not dismiss a threat of suicide. Stay with the person and get help. If someone is thinking about suicide, some of the warning signs are talking about death, losing interest in favorite things, expressing a sense of feeling hopeless or worthless, putting affairs in order, or calling others to say goodbye. Another sign is when someone has been very depressed and suddenly becomes happy and calm. If someone says, I'd be better off dead, immediately get help for them. Question 53. After the death of a loved one, how long should a client grieve? A. About 6 to 9 months. B. There is no time frame. C. Depends on who passed away. D. 1 year at the longest. Answer B. Explanation. Each person's grief is different and personal. There is no specific time frame to heal after a loved one's death. Cultural lesion and the amount of support can affect the grieving process. Always support the client and do not rush them. The entire process can last from 6 months to 4 years. Question 54. Whenever a patient visits the care facility for a short period of time only, to give their usual caregivers a break, this is called A. Respite care, B. Hospice care, C. Therapeutic care, D. Constant care. Answer A. Explanation. Caregiving is demanding, both physically and mentally. Respite care gives family and caregivers a chance to temporarily rest while the patient is cared for in a facility. Respite care can be during the day, for a weekend, or for a few days. It can also take place in the patient's home. Question 55. A resident's wife recently died. The resident is now staying in his room all the time and eating very little. What is the best response by the nurse aide? A. Understand that he is grieving and offer him chances to talk. B. Tell the resident that he needs to get out of his room at least once a day. C. Remind him to be thankful for the years he shared with his wife. D. Avoid mentioning his wife or their marriage when caring for him. Answer A. Explanation. Following the death of a loved one, grief is a natural reaction that allows a person to work through their loss. Initial grief can hurt physically with a tight throat, headaches, insomnia, itches, and weakness. Offer the residents soft, comforting food such as soup or pudding, but don't push them to it. They may also need to be alone for a while, but do not leave them isolated. Visit their room and ask how they are doing. Let them talk and cry without judgment or interference. Watch for signs of depression and report them to the nurse. Question 56. The learning and behaviors of a group passed from one generation to the next is A. Wisdom, B. Religion, C. Control, D. Holism. Answer C. Explanation. Control is the knowledge and all the characteristics of a group that are shared by a group. It includes behavior, language, religion, food, etiquette, holidays, symbols, art, dancing, and music. Even possessions that are passed down are part of the control. Control is shared by communication and imitation from one generation to the next. Question 57. While helping a resident, the resident hits you. What should you do? A. Leave the room immediately. B. Report the incident to the charge nurse. C. Firmly tell the resident never to hit you again. D. Pretend it did not happen. Answer B. Explanation. If you are hit by a resident while giving care, notify the nurse. You may be asked to complete an incident report. If you are injured, get treatment. Always remove yourself from harm by stepping out of the way of the resident's reach. Remain calm and explain that hitting is not acceptable. Question 58. Which statement is false? A. A person's cultural influences health and illness practices. B. Religious and cultural practices are not allowed in the healthcare agency. C. Cultural religion influence food practices. D. A person may not follow the beliefs and practices of their religion or culture. Answer B. Explanation. Healthcare agencies should always respect the religious and cultural practices of their clients. Each agency should learn as much as possible about the religious and ethnic groups they treat and how the groups view medical interventions so that appropriate communication can take place. Even if clients do not strictly follow all aspects, there may be beliefs that are important for them. Question 59. Death of a partner results in the loss of A. Friend, B. Lover, C. Companion, D. Of the above. Answer D. Explanation. Loss of a spouse is considered the most stressful event in a person's life. Even when the death is anticipated, the sense of loss can be overwhelming. The remaining spouse must cope and rebuild a life without the partner. Grief can be profound, so the person needs time and support. There is no timeline for recovery or correct way to grieve. Each person is different. Question 60. Treatment for mental disorders can include A. Medication, B. Support groups, C. Psychotherapy, D. Of the above. Answer D. Explanation. Patients with mental disorders may have treatment options. No single treatment works for everyone, so patients work with their doctors to find the best combination. Psychotherapy is important to help patients learn about their thoughts, feelings, and behaviors. Medication is not a cure by itself, but when paired with therapy, it can be very effective at managing symptoms. Support groups allow people with similar disorders help each other. Thank you for watching.